So good morning, and thank you very much for the introduction. I specialized in assistive technology research and development. My work focuses on designing and implementing systems that apply devices, ICT, and AI to support everyday life and care. In the AI domain, I have been involved in national initiatives. For example, I contribute to a practical handbook published by Japan's Children and Family Agency to support the introduction and use of generative AI in child care centers and local governments. I also collaborate with companies developing communication robots where we organize study groups and workshops on AI ethics and responsible implementation. Today, I will talk about gender through the lens of assistive technology development. In my discussions about inclusive AI, we focus on algorithms and the models. However, today I would like to step outside the model and look at inclusion from perspective of real-world design. I lead the Wellbeing Engineering Laboratory at the University of Tokyo. Our group studies assistive technologies, inclusive design, and AI systems that support everyday life, especially for older adults and persons with disabilities. Importantly, our research is field-based. We observe what actually happens in homes, hospitals, and communities. So rather than asking only, is the algorithm fair? We also talk, does this technology truly work for everyone in practice? This real-world viewpoint is central to today's talk. As AI care increasingly emphasizes this monitoring and unobtrusive watch over support, our lab explores sensing technologies that large language models and vision language models to understand daily activities and contexts. However, the key challenges are not the AI itself, but the ethical, legal, and social issues that arise when these technologies are deployed in real-world care settings. When we talk about inclusive AI, we often focus on algorithms, bias correction, and fairness metrics. They are, of course, important, but inclusion is not created only inside models. It happens when technology meets people through products, interfaces, and everyday use. For example, even a perfectly fair algorithm can still exclude someone if the device is too heavy, too large, or difficult to operate. So today I approach inclusion from a design and use perspective. Historically, many products were designed with men as the default users. For example, car safety tests use male crash dummies. Medical trials excluded women. Tools were sized for male bodies. So women were not intentionally excluded. They were simply not considered. This tells us something important. Exclusion often emerges quietly, not because of bad intentions, but because someone is treated as standard. This lesson is still relevant today. Let's take a moment to look at this figure. You can clearly see that women live significantly longer than men. The gap is about 6 years. And among people over 100 years old, nearly 90% are women. This means that most assistive technology users are women, especially with the increase in single-person households. More women rely on technology rather than family care. Furthermore, considering the economic disparity, there is a massive demand for affordable, standardized products. So naturally, companies design products for this majority. From a business perspective, this is completely rational. But here is an important question. Does majority automatically mean inclusion? This question motivated our study. In long-term care certification, women are about twice as likely to require care. Assistive devices are distributed through this system. So devices are selected, evaluated, and optimized mainly for women. Again, this is logical and efficient. However, when decisions are guided only by averages and large numbers, some people inevitably disappear from consideration. And those inevitable people are often minorities. Let me share a concrete example for our project. We developed an automatic brake system for manual wheelchairs. The first commercial model had a low seat height. Why? Because many older users are small stature women. So we optimized for the largest market. At first, we believed this was an inclusive design. But during field testing, something unexpected happened. Some taller users simply could not sit safely. One participant told us he needed assistance every time he transferred to the chair. For him, the device actually reduced independence. That moment made us rethink our assumption. Designing for the majority did not guarantee inclusion. It actually created exclusion. So we analyzed the survey data. At first, we expected women to use more devices overall, but the results were more complex. Men showed higher demand for information support devices. Women showed higher demand for mobility and care support devices. So needs are different, not simply larger or smaller. This might reflect traditional gender roles or career backgrounds where men were more exposed to IT, while women were primary users of care services. This means market majority does not eliminate minority needs. Even small groups have distinct and important requirements, so minority male users can experience what I call a hidden exclusion. Not dramatic discrimination, but small mismatches that accumulate over time. Products simply do not fit them. These quiet mismatches often go unnoticed, but they still matter. So why does this happen? Importantly, This exclusion is really intentional. It emerges from very common practices: welfare-oriented design, average optimization, and majority-focused markets. All of these are rational. All of them aim to help many people, but together they make minority users invisible. So the issue is not ethics, it is structure. If we look at the development process, we see planning, commercialization, and dissemination stages. These emphasize scalability, cost efficiency, and large markets. Naturally, decisions prioritize majority users. So exclusion often emerges here, not during ethical discussions, but during practical market decisions. In other words, the system works rationally, but still produced exclusion. Finally, where is inclusion actually determined? Layer 1, algorithms are like the engine, but engines alone do not decide who can ride. Layer 2, product design defines the dimensions. For example, something as simple as the height of wheelchair. If diversity is ignored at this stage, exclusion inevitably appears in layer 3, real-world use. So inclusion or exclusion is not decided only by code. It is decided in design and everyday practice. This is why design perspectives are essential for inclusive AI. To build truly inclusive AI, we must understand the diverse physical and social realities of our users. To conclude, even well-intentioned technologies can unintentionally exclude people. So if we want truly inclusive AI, we must look beyond algorithms, but also design, markets, and everyday life. Thank you very much for your attention.